لابد من أول حالة إصابة بفيروس كورونا.
While the efforts to unravel the mystery surrounding the new SARS-like virus continued, WHO intensified efforts to improve preparedness to protect global health. Since the virus emerged in 2012, WHO worked hand-in-hand with the affected countries and other international health partners to share information, improve surveillance for early detection, and rapid response to contain the virus and limit transmission. A technical consultative meeting was organized in January 2013 to better understand the public health risks. Affected countries and partners identified what was known then and what remained unknown. Soon after, a special supplement of the Eastern Mediterranean Health Journal was published in May 2013 on this novel virus, which presented the most up-to-date scientific knowledge on the epidemiological, clinical, and virological characteristics of the virus. As the global preparedness continued to scale up, a hospital outbreak in Al-Hassa province of the Kingdom of Saudi Arabia triggered mounted fears and heightened global concern. WHO and the Ministry of Health rapidly investigated and brought a halt to the transmission. The key lesson of the outbreak was that effective infection prevention and control measures need to be applied in all health facilities to stop any hospital outbreak.
We have seen that it's been around since 2012, but we didn't know about it before. It's been really quite severe in those that it has infected. This is a virus which has been around now for over a year, so it's been persistent in the Middle East and continues to cause cases.
The outbreak in Al-Hassa reminded the global community of the urgency to improve readiness for a possible upsurge and rapid international spread. WHO organized an inter-country meeting attended by officials of ministries of health of all countries in the region, as well as from France, Germany, and the United Kingdom. A readiness plan to ensure improved international vigilance for early detection and containment were the key outcomes of this meeting. The surveillance efforts for the virus intensified across all countries in the region soon after. Assessment and trainings were conducted by WHO and other international partners on laboratory diagnostics in an effort to improve detection capacity of the countries for this new novel virus. In 2013, WHO responded to a request from the Qatar to field investigate a cluster of human infections from the virus. While the investigation resulted in containment of the spread of the virus, efforts to further investigate the source of infection led to detection of the virus in dromedary camels. The detection of the virus in camels was an important scientific finding in WHO's search to identify origin and source of this virus.
The emergency committee did highlight a number of areas where they thought that particular attention should be given to. And so some of these areas include things like surveillance, ensuring that countries have the capacity in their laboratories to make the diagnosis if the infection is there. They noted that the largest outbreaks take place in health facilities to date, and that infection control was really a critical area, and that we should work with countries to make sure that those guidelines are understood by healthcare professionals and really implemented.
While the effort to identify the source of human infection gained momentum, WHO organized a meeting to determine the public health research agenda which can identify the source of human infection, as well as routes of transmission which remained unknown. This was followed up by another meeting in Riyadh, and a protocol was finalized for conducting a case control study in the affected countries under a joint collaborative effort. This was the first time that affected countries, WHO, the Food and Agriculture Organization, and the World Organization for Animal Health collaborated together to come up with a plan for animal and human health studies to know the unknowns of this virus. Mass gatherings, such as the Hajj, present opportunities for rapid international spread of diseases. The virus continued to pose a global risk of spread during Umrah and Hajj. WHO worked closely with the Ministry of Health of Saudi Arabia to improve preparedness and protect global health. Except for some sporadic spread with the returnee Umrah pilgrims, the Hajj seasons since the virus emerged were free from any major health event. Preparedness paid off. and global health was secured. An upsurge of cases and hospital outbreaks during the spring in 2014 raised the concern of yet another public health crisis. WHO rapidly investigated these upsurges in the Kingdom of Saudi Arabia and in the United Arab Emirates, and the transmission was stopped following strengthening of required public health measures. In a bid to make a safer world, capacities of frontline healthcare workers of the affected countries were rapidly built through 2014. Training courses were held urgently on infection prevention and control, and was followed up with another training on outbreak investigation of rapid response held in Sultanate of Oman. A workshop in Morocco focused on ways and means to enhance surveillance and early detect any possible signs of the virus. As the Muslim pilgrims began to assemble for the Hajj in 2014, educational and awareness materials were rapidly rolled out demonstrating simple preventive measures to avoid infection. These information resources were made available to countries across the entire region. In February 2015, a team of experts from WHO, FAO, the World Organization for Animal Health, and the Institut Pasteur in France conducted a mission to Saudi Arabia to assess the current situation of MERS CoV following a surge of cases. The team, with the Saudi Arabian health authorities, identified the main areas that need to be urgently addressed.
The outbreak caused by the Middle East respiratory syndrome coronavirus remains a concern to all of us. Since its emergence, WHO has been coordinating actions with member states to improve preparedness, enhance public health response, and address critical information and knowledge gaps in the fight against this virus. We believe it's our collective responsibility to combat this threat. WHO continues to work with member states in protecting regional security and global health under the international health regulations.